Hi, I'm Neha Matthews, and you're listening to Three Things, the Indian Express news show. Frontline workers across the world, our healthcare workers, police officers, sanitation workers, they've been integral in this fight against COVID-19. And by attempting to protect our lives, these individuals are now more than ever putting their own at risk. To celebrate their effort during these trying times, across the world we've had symbolic gestures, lighting candles, clapping, banging vessels, and a plethora of songs. But the COVID-19 pandemic has put immense pressure on these frontline workers. It's not just the fact that they are at high risk of contracting the virus because they're outside working, often exposed to COVID patients. It's also the stigma they've been receiving. Doctors and nurses being asked to vacate their houses by neighbors and resident welfare associations. Even the mental distress of working in such challenging times. And what's worse for these individuals, particularly healthcare workers and policemen, they're being attacked while they're out in the field. Here's an excerpt of a Ranchi doctor's video about being attacked on her way to work. It's not the first such incident in India.
रोड सामने से हट गए, फिर मैं आगे निकलने की कोशिश की तेज, तब तक पीछे से बहुत तेज आवाज आई मुझे। मैंने देखा कि मेरे पूरे ग्लास टूट गए हैं और वो शीशा पूरा बिखर के मेरे ऊपर, मेरे एप्रन में, सभी जगह पे पूरे गाड़ी में फैल गई थी।
Now, healthcare workers, for years, have complained about being attacked on the job by patients' families, but it's become so much worse with the misinformation and the fear people are facing with this pandemic. In all of this building tension, the recent incident of a Chennai doctor who had died of complications arising from COVID-19 and was then denied dignity in death at the funeral, it was the last straw. It's a second such incident of its kind. Mobs disrupted the burial of a leading Chennai neurosurgeon, Dr. Simon Hercules, at 2 burial grounds. They were presumably afraid that burying the body of a COVID patient there would infect the area around it, and they attacked his family, ambulance drivers. On a popular TV news program, his friend recounted the ordeal he faced and how eventually he had to dig the pit to bury Dr. Hercules' body.
But the people who yesterday attacked us, they were not knowing. They all that they did was, you are not supposed to bury a body which is corona positive here. Get lost. Take the body, run away. They attacked us. They hit us. They made us bleed. They made us run for our lives. I don't know how many people would have experienced burying someone. I have never buried anybody, sir. I have seen death in my hands, but I've never buried anybody. So,
on this episode, we talked to our reporters about the pressures these frontline workers are facing: mental health issues, mob attacks, lack of PPE, surveillance. Anuradha Mascarenhas, who reports on health for our Pune bureau, talks about what she has learned from her interactions with healthcare workers in the city. Anuradha, in the course of your reporting on this pandemic, you've interacted with many healthcare workers and, you've talked to them about the sort of pressures they're facing. This will obviously impact whether they can effectively care for COVID patients or not. Now, one issue that has arisen for private hospitals, at least, is dwindling revenue and increasing costs. Could you tell us about that?
When the coronavirus started, there was a big scare, and according to some hospitals in Pune, at least, a lot of people just left, like right from the healthcare staff to nurses to, even junior doctors who just kind of disappeared because obviously we've been reading about what's happening in Spain, Italy, France, etc. So people were aware about how the cases would develop and how it would start increasing. And in the healthcare fraternity, there was a huge scare. So nobody had tested positive then because initially it was the government hospitals that was actually looking at all these cases coming from abroad. But once after, say, in the first week of April, and when the deaths started occurring in Pune, that led to a big scare and a lot of people just started leaving. And then, of course, there were advisories that elective surgeries should not be held. And OPDs, the footfall was there was a decline. There was almost more than 50% reduction in the footfall. And so obviously all this hampered the financial kind of costs, which the day-to-day cost of, running a hospital. So obviously salaries have to be given, and obviously people have to manage all these dialysis machines and all those other things. But at least the authorities have been saying that now looking after COVID-19 patients is like a huge, huge cost, which then now they are hoping that the government will help them out in this situation. So it's been a basic financial loss on the part of the private hospitals.
You mentioned that most of these doctors or healthcare workers had stopped coming. Are they facing a shortage in staff currently?
So what happened is basically some doctors have admitted, that they have to actually coax them and tell them that everything will be okay. We'll give you enough of personal protective equipment and masks. Don't worry. Because in some cases, why they disappeared is because where they were staying, the landlord refused to let them back in their whatever small rooms those areas. See, these nurses and the healthcare staff, they come from very far areas. So because of the lockdown also, there's a problem in coming to the hospital. In one hospital, there were like nearly 60 people who've not been able to come. And this is somewhere in Nobel Hospital. In another hospital, there were like 18 people who left on the very first day itself. So with all this crisis, there have been several meetings with the district collector and the health authorities and how to manage the situation.
And, in our earlier episode, we had talked to a healthcare worker. This was around, I think, March 27th. And she had pointed out that the need for uniform instructions across the board to all healthcare workers was an issue. And also the lack of PPEs she could see becoming an issue later. Is this something doctors and nurses are still facing?
So obviously there has been some kind of improvement over the last 1 month, though of course hospitals and administration are working together to ensure that whatever, like in medical association, they're saying that even if you cover yourself like with a proper double, triple layer mask and, wear these goggles and these gloves and cover your head and, have another protective gear on the head. So basic, simple things, at least at fever clinics or, initial point of care treatment rather than when you're interacting with a COVID-19 patient, which requires the PPE. So these temporary measures are being taken up, like at these small fever clinics or OPD. So that way, PPE, they are actually keeping it, at the point where you require it in isolation wards or when you're actually interacting with the positive corona patient.
So these other people who are not directly dealing with corona patients, but they might still be at risk because they are seeing other patients. Are we seeing them maybe fashioning out their own PPEs as we're seeing on, in photos across the world?
So at some hospitals, they have these people who have been employed to actually stitch these masks. And there have been reports at a government hospital where they have been making masks for their own healthcare staff. So these are basic cloth masks. So at least everybody's noses and mouth are covered.
A lot of mental health professionals actually have talked about how there's a, inevitable mental health crisis that we're going to see among frontline workers, like doctors, like nurses. Is that something that we're seeing in India as well?
Oh, yes, especially in the month of March, actually. A lot of calls were received by the state helpline 104, at least more than 37 to 38,000 calls just to ask as to what is this corona, kya hai, etc., etc. It was not even a mentally affected or stressed out kind of call. But later on, when everybody realized all this is happening, people started feeling stressed out because some doctors, their wives, their family members, they refused to allow them to go to work. Nurses or people who are coming from far-flung areas, their husbands refuse to drop them because obviously the public transport is not easily available. So how do you communicate from the house to the hospital? They said, "Nahi, forget it, just leave your job and sit at home." All this has been affecting a lot of doctors and their families, nurses, staff. So obviously that kind of counseling was required. So at a government hospital, this Sassoon General Hospital, they set up a helpline to kind of reach out to these doctors. And they found that 35 to 40% of their callers were the healthcare staff who were really, really stressed out.
Next, Abantika Ghosh, who reports on health for the Indian Express Bureau and has been extensively covering the pandemic. She talks about why the Indian Medical Association had planned protests today, why city doctors are wary of surveillance, and how a new ordinance is meant to protect these healthcare workers during the pandemic. So, Abantika, the Indian Medical Association had initially called for a white alert protest across the country on Wednesday, and then a symbolic protest today where healthcare workers were supposed to wear black badges to work. Could you tell our listeners what triggered this protest?
There have been multiple incidents across the country of healthcare workers, either when they are on, because there is this house-to-house survey that's happening in containment zones, either in those kinds of situations they have been attacked. That happened in Madhya Pradesh. Then there have been instances of RWS sort of creating problems for doctors coming back from work. Then also there was this tragic incident in Chennai where the doctor couldn't be buried where he was supposed to be buried because people protested. So there's a lot of fear among people about COVID and, all this talk about asymptomatic transmission and all that. So there is this thing that the healthcare workers could bring in the infection. So that was the background really that triggered the IMA protest. And it's been happening, I think almost for the last 2 months on and off in various states. So that's what triggered the protest.
And they eventually, called off these protests after they talked to Home Minister Amit Shah yesterday. And he promised them there's going to be immediate action that will be taken to protect these healthcare workers. Could you tell us what eventually happened there?
So he met IMA, he along with Health Minister Dr. Harshvardhan, they met IMA officials. There was another meeting in the Health Ministry where there were IMA people, there were various stakeholders, units, WHO, UNICEF, all these people, partners, basically development partners, in which things were discussed about what are the things that the government is doing for doctors and all that. And Home Minister Amit Shah later tweeted also about the government being committed. And that's also yesterday, the cabinet passed an ordinance to basically make amendments to the Epidemic Diseases Act 1897 that makes any act of violence or assault against doctors very, very severely punishable. The punishment ranges from 3 months to 7 years. 7 years is like for grievous injury. And also the fine ranges from 50,000 to 5 lakh again is for grievous injury. So that has happened. Then the Home Ministry has written to the states, the Health Ministry has written to the states, 2 separate letters, the Health Secretary and the Home Secretary, saying please ensure their safety and these are things that have been done, so please ensure they're implemented.
I mean, before this pandemic as well, we used to hear about lots of attacks on doctors before. There have been numerous protests in the past. But before this ordinance, was there no other such law in place?
No, there was no such stringent law in place. And also, this is a very different kind of a situation. These people are already very stretched in various ways.
Abantika, was wondering now, Delhi particularly has a huge number of cases of doctors contracting COVID-19, usually from exposure to patients. What is happening to these doctors? Are they still working? Are they quarantined?
That's actually another issue because I was just talking to somebody from AIIMS, a nurse actually, not a doctor. So you have to understand one thing. While a lot of the attention, Delhi government sending doctors to 5-star hotels, a lot of the attention has essentially been on doctors. But when it comes to patient care, it's the nurses, ward boys who come in far closer contact for far longer duration with the patient. So if you're talking about doctors, we essentially need to alter that narrative to say healthcare workers, because all of them are equally exposed. And any one of them going back to their colonies, going back to their families and infecting somebody else or themselves turning positive is going to result in a new containment zone possibly. So that's one thing. So as I was saying, I was talking to this AIIMS nurse and she was telling me that there's somebody in the CN center there, nursing officer, who's tested positive. And while lists have been drawn up of all those people who were on duty with that person, but nobody has actually been quarantined. And this person was telling me, even I was on duty with this person and I am scared. I have a family back home. I don't know what to do. Then, you might have seen there are these pictures being circulated of AIIMS health workers coming to work in a bus. They have masks on, but there's absolutely no social distancing. It's a normal bus where people are sitting, 2 seats, both seats people are sitting. I mean, you can see the kind of fear, and they are actually seeing firsthand what this disease does. So they are also scared. So this is actually adding to the pressures that they already have.
And there seems to be a feeling of also disgruntlement where I think in Delhi particularly, or even in Karnataka, there has been talk about how the police is monitoring WhatsApp groups of healthcare workers. Do we know why that happened?
So in Delhi, what happened was, this was one of the first communications that came out about the lack of PPEs and about the lack of quality PPEs, because there are certain standards. In Calcutta, there were doctors wearing raincoats. So you can't have that sort of thing. There has to be a proper PPE that a doctor has. So at one Delhi hospital, there was a communication that had come out about the quality of PPEs by the Resident Doctors Association, if I remember correctly, some doctors association. And after that, the Delhi police asked for information on WhatsApp groups of doctors. So that caused a lot of angst as well, because these are legitimate concerns. And it's the same as, throughout this government, we've heard a lot about soldiers being sent to the battlefield without bulletproof jackets. So this is exactly what it is. Sending doctors somewhere where there is a COVID patient without proper PPE is the same thing. So there's a lot of narrative at the top, but I suppose it's taking time to percolate down.
There's also this rule that came in that, we have not too many PPEs and that they should be preserved for doctors who are directly dealing with or nurses directly dealing with COVID-19 patients. Is that putting other doctors at risk? Are they worried?
Yes, of course they're worried, because just yesterday the ICMR said that 69% of patients in India have been asymptomatic. So if a person comes to the emergency, say even if it's just a broken limb, if you don't have a PPE and you're not testing that person, you don't know what you're exposing yourself to. And this is happening every day. That's not something that you want to expose yourself or your family to. And we've had reports, I think, in Bombay about a doctor who was sleeping in his car till this news got out and arrangements were made for a hotel room. So these are the kinds of circumstances they are working under. And they're obviously, even in the best of times, doctors are extremely, at least in government hospitals, are extremely overworked. You can imagine what's happening now.
Last, Amil Bhatnagar, who reports on Western UP for the Indian Express, talks to us about mob attacks on these frontline workers. Now, during the pandemic, news of police brutality on migrant workers and those defying the lockdown, it's made headlines, and we've covered it in previous episodes. But in many areas, the police themselves have been facing attacks. Amil joins us over call to explain. Amil, so last week we had heard about frontline health workers. It was a team of doctors, sanitation workers, and of policemen who had gone to a district in Moradabad, and they were attacked there. Could you tell us what duties they were carrying out there and how they were attacked?
So basically, in Moradabad, a death had taken place last week, and a medical team, along with 4 constables of the local police station and a few other workers, had gone to carry out standard quarantine procedures, which was to take the family members in, because they had been exposed to their family member who was tested positive. So they were supposed to take the family members to the isolation wards, get the test done, sampling done, and carry out the routine procedure. So at some point of time during the procedural work, they went to this particular colony in Nawabganj. And after that, a crowd of around, say, 10 to 15 people initially gathered, and there was some argument about them resisting the movement of these family members. They were basically saying that, you cannot take these family members just like that. So there was some altercation between the police and locals like that. Then the argument escalated, and suddenly from the lanes and by-lanes of this entire area, around more than 100 and 150 people gathered, and they started pelting stones at the officials, at the doctors, at the health workers, at the policemen. There were reports of men and women pelting stones from the top of roofs, and it was a lot of chaos. There was a police vehicle that was damaged, an ambulance was damaged. There were health workers who were injured. In fact, 7 people, including a doctor, were injured. That doctor had to be admitted to the hospital for head injuries, and it was a lot of chaos. In fact, one of the health workers who spoke to the media said that in such a situation, he doesn't feel like working because there was no protection. There was some policemen, there weren't adequate number of policemen, and he was specific about the fact that if we have to do this, we will not survive. And I think these are not proper working conditions if you have to be attacked for the fact that they're going to save people only. They're in the front line of this battle, and they allege that if they are not provided adequate protection, there's no way that they'll be able to function properly.
From what I recall, the UP government had a very strong response to this incident as well. Could you tell our listeners what that was?
So UP government took notice of the incident immediately, and they slapped the NSA against the accused. Several people were detained the same day, several arrests were made the following day, and the UP government had made it categorically clear that they would take every strict action against these people, because it is in the interests of their very own that these medical workers, these policemen go out and carry these sanitization, quarantine procedures in these areas, right? So already they are at risk of exposure to the disease itself, and then an added animosity and aggression by the public will only escalate their problems, and in turn it will cause problems to the public only, because if they stop going, if they start revolting, then there'll be no healthcare penetrating in these areas, right? Moradabad has seen 5 deaths so far, and it has more than 50 cases. So the cases still in these areas are rising up, and the government wanted to send out this message through this action, this punitive action, that it wants to deter people from not cooperating with the police, and they want to basically make people fall in line, because it is at the end of the day for their own benefit. So yeah, National Security Act is a very stringent act to be pursued because it removes the chances of getting bail. So that was the action by UP government, and like they said that in any incident they will resume this course of action whenever there's a report of an health official being attacked.
Now, I mean, you have been reporting on the coronavirus pandemic, and you have been talking to a lot of policemen, a lot of healthcare workers during this time. Could you tell our listeners, do they face challenges like this often during this period? Other sorts of incidents that they faced?
So there are two ways to approach this. One is through the perspective of police who are enforcing the lockdown, which is also a part of the general measures to tackle this disease. And then the other is the healthcare workers, obviously, who are looking at the medical aspect of it. So when it comes to the police, the general complaint, like I was in conversation with police chiefs from Saharanpur, Muradabad for that matter, Bulandshahr, Meerut, all these districts in Western UP. So the common thread of complaint that most of them had was the fact that there are people still gathering. There are gatherings taking place in lanes. People come out for an evening stroll. Some people come out to a park, not realizing that even a gathering of 2 to 3 people in itself is problematic because they have to maintain social distancing. So they go around in a vehicle and they tell people that, this must not be done and this is not the right thing to do. And even despite that, despite the warnings, despite the announcements, despite every sort of information dissemination, there are still people coming out for prayers, coming out for leisure purposes. So they're like, we have limited number of policemen on the ground, right? And again, we are also at exposure. So we cannot 24 hours be monitoring a house, or we cannot be monitoring a colony, and yet we try and do that. So their complaint is that we do FIRs, we challan, we take action, and yet people are still coming out not realizing. So that is becoming a task.
In fact, on Wednesday morning, locals pelted stones at Aligarh police when they were trying to enforce lockdown in Bhojpura area. Essentially, there was an argument between vegetable vendors and they were opening their shops beyond stipulated time given by the administration. And when the police reached on the spot to enforce the lockdown, there was an argument, and then from nowhere, 15-20 people gathered and there was heavy stone pelting, and they had to call a backup to get the situation under control. So yes, this trend is being observed in several parts of UP.
For doctors and medical workers, the other aspect is the idea of misinformation. So whenever they go to a house or they go and speak to people, the general feedback is that people are generally not aware about what needs to be done. So for a lot of people, their idea of taking a precaution for granted is what is observed by the doctors. Like they think that, it is fine that if I can just meet my neighbor, it is fine that I can just, call someone to the house. For the doctors, they carry out sanitization procedures or screening processes for that matter. In fact, there have been several cases where people had not given the right information to the health workers who were screening them for information. So this lack of information for them, this lack of awareness for them, and they're doing their best. They say that, we try and tell them, we have conversations with them, and still we see that, they're consuming news and they're consuming information from some platform which is not accurate, and then they base their opinion on that. So the first, they'll have to rebuild their entire system of knowledge for them that this is what the disease does, this is what you need to do, and then get them to carry out the necessary precautions. So there are a lot of things happening on parallel where some people are aware and yet they're not realizing the gravity of it, and some people are absolutely not aware. So that's the kind of challenges that are being faced on 2 levels.
You were listening to 3 Things by the Indian Express. Today's show, as always, was edited and mixed by our producer, Joshua Thomas. If you like the show, then do subscribe to us wherever you get your podcasts. You can also recommend the show to someone you think will like it. Share with a friend or someone in your family. It's the best way for people to get to know about us. You can also tweet us at Express Audio and write to us at podcasts@indianexpress.com.